Welcome, everybody. It's a pleasure to be here with you for this sixth in the Mind Philosophy series, this sixth talk. We are joined today by speaker Jaipreet Mattu, who I will introduce in just a moment. My name is Michael Kramer. I will be the moderator for this session. I am replacing Marvin, who unfortunately couldn't join us due to a last-minute scheduling difficulty. I am the co-speaker for the philosophy professional section with the Mind Foundation. And it is my great pleasure to introduce our speaker for the day, Jaipreet Mattu. Jaipreet is a PhD student at Western University in Ontario, Canada, and a member of the Rotman Institute of Philosophy. Her research focuses on psychedelics, psychiatry, and neuroscience, and has recently co-authored an article in the Journal of Psychedelic Studies with Chris Letheby entitled Philosophy and Classic Psychedelics, a review of some emerging themes. Her talk today is entitled Psychedelic Psychiatry and Philosophy of Science. And with that, I hand it off to you, Jaipreet.
Thank you so much. I'd like to thank everyone for being here today. I'd also like to thank the organizer of this seminar series, Dr. Chris Letheby, and the Mind Foundation for inviting me and providing me a platform to discuss some of my research. So today I'll be providing some insight into philosophical issues in psychiatry and the debates emerging from them, and also a discussion about the implications that psychedelic science has on psychiatry and the issues I discuss. I'd like to make one distinction first, and this is between preclinical and clinical research. So preclinical research refers to studies that are done on animals, which are typically monkeys and rodents, whereas clinical research refers to studies that are done on humans in clinical trials. So I'm going to start with a discussion that motivates what's going on with psychedelics and psychiatry. So I'll start with the status quo. Then I'm going to talk about classic psychedelics, which will be the focus of this presentation. And I'll end this section with a discussion about the importance of the psychedelic experience. So currently, psychedelics are at the forefront of psychiatry and neuroscience, and there's an emerging sentiment that they can transform how we understand and treat mental illness. There's also a widespread consensus that we're currently living in what's been dubbed the psychedelic renaissance, and this refers to the revival of scientific research and public interest into understanding the therapeutic potential of psychedelics. And this generally and largely stems from growing frustrations towards conventional mental health care and the lack of novel drugs to combat the global rise of mental illness and also existential suffering, which we've seen a significant rise in since the start of the COVID-19 pandemic. Now, this may seem surprising given the number of psychiatric medications that are commercially available. However, pharmaceutical companies are nowhere near developing treatments that effectively target symptoms of mental illness. And there's a lot of backlash concerning the adverse side effects of these drugs and the length of time it takes for patients to see any kind of progress. For example, in many cases, individuals must take medication daily and for most of their life, if not their entire life. And it can take months before this benefits of these drugs actually take effect. And some of the adverse side effects include weight gain and weight loss, sexual dysfunction, and tapering off. Some of these drugs have been known to actually increase the risk of suicidal ideation. So despite the extensive research that has gone into drug development, we aren't actually anywhere close to alleviating the global burden of mental illness. As a result, scientists have actually started looking for alternative treatment options. And this is where psychedelics actually come into play. It happens to be the case that psychedelics have been shown to remarkably decrease symptoms of mental illness and related conditions such as anxiety and depression that accompanies a cancer diagnosis, for example. And so in the last 2 decades alone, there's been a wave of clinical trials that have shown that psychedelics are a promising treatment for a range of psychiatric disorders. And they've also shown to have positive and psychological behavioral changes, not only in the long run, but also just after a single dose. And most of the headlines that we see in the news today is because of the pioneering research and work of organizations such as the Multidisciplinary Association of Psychedelic Studies, or MAPS, and research institutes at the Imperial College in the UK, Sao Paulo University in Brazil, Johns Hopkins University, and of course, there are many others. An additional facet regarding psychedelics is that what we currently know about their impact on the mind, brain, and behavior is mainly understood through recreational use and also somewhat through religious and ritualistic use. Their side effects have only been recently understood through observations made in small-scale clinical trials. So what scientists are aiming to do is understand the brain mechanisms underlying the actions of psychedelics. And it's only then that they can be converted into viable treatment options. So basically, we need to know how psychedelics work in the brain in order to use them to treat mental illness. So I want to make a note on the scope of this lecture. I'll be focusing exclusively on a class of psychedelics referred to as the classics or classical psychedelics. So these are the drugs that you actually see receiving the most favorable media coverage, and some of which have been decriminalized or are on the verge of decriminalization. I'll be referring to them as CPs throughout the presentation sometimes, but I will be sometimes saying classic psychedelics as well, so I'll interchange between that term. But this includes lysergic acid diethylmide, which is LSD, psilocybin, which is found in magic mushroom, mescaline, which is found in various cacti, and N-dimethyltryptamine, or DMT. And this is found in various plants and animals, and it's also a key constituent of the traditional Amazonian tea called ayahuasca. So I won't be discussing substances like ketamine or MDMA, and these are sometimes referred to as psychedelic because from a pharmaceutical perspective, they can induce psychedelic or hallucinogenic-like effects. I'll just strictly be talking about classic psychedelics. And the reason I actually have the individual chemical structures here is because classic psychedelics have a very similar structure to serotonin. So serotonin is a chemical in the brain, and some of you may already know that serotonin is important for regulating mood, and it also has a role to play in memory and learning. And dysfunction of serotonin is also implicated in depression. So sometimes classic psychedelics are referred to as serotonergic psychedelics, but this term isn't necessarily debated. It's just that there are other non-classic psychedelics like MDMA that also fall under the umbrella of serotonergic psychedelics. But what's most important to take from this is that classic psychedelics act very similar to serotonin. The human brain actually has different kinds of receptors within it that chemicals like serotonin interact with specifically, which they do this and they mediate their effects. And it just happens to be the case that classic psychedelics interact with a specific serotonin receptor called the 5-HT2A receptor. So CPs mediate changes to the brain primarily via their high affinity for binding quite neatly onto this brain receptor. And I'll get more into this later in the presentation. The last thing I want to mention is a key driver of CP research, which is the psychedelic experience or the psychedelic state. Now, this is an altered state of consciousness described as being mystical or spiritual, and it also involves visual and sometimes auditory hallucinations as well. Participants in clinical trials experience this state through consumption of moderate to high doses of CPs. And these are subjective experiences that differ between individuals. But apart from the hallucinations, some characteristic experiences that pertain to the mystical and spiritual effects of CPs include feelings of unity and connectedness with others and nature, spiritual encounters with God or an ultimate reality, ego dissolution, which is characterized as a loss of self-awareness. And in more instances than not, individuals report that they feel liberated of existential and mental suffering, and that they've gained psychological insights about themselves and others and a new profound meaning of life and perspective about the world. And what's most interesting is that evidence from small-scale clinical trials have shown that there's a strong correlation between the intensity of psychedelic experiences and positive clinical outcomes. And so it's hypothesized that there is a connection between the psychedelic experience, the promotion of personal growth and development, and counteracting symptoms across psychiatric disorders. So moving on to the second part of the presentation, I'm going to discuss some philosophical issues in psychiatry that have been discussed in the philosophy of science literature. The philosophy of science is a branch of philosophy concerned with the foundations, methods, and knowledge implications of science. Philosophers of science ask questions like, what counts as science? And they also address issues in science and analyze theories and methods that scientists make use of, along with the analyses of the data that scientists publish. And when it comes to psychiatry, historically, both scientists and philosophers have been interested in the nature of psychiatric disorders. So on the one hand, they are interested in explaining mental illness. That is, what kind of thing is a psychiatric disorder? And this actually ranges from different views that have been put forward, from ideas such as mental illness is a naturally occurring phenomenon in the brain that is the result of dysfunctional brain mechanisms, to the idea that mental illness is merely socially constructed and it's just meant to serve us in some way. So for example, for medical, political, and legal reasons. And some other things that are discussed in terms of social construction or being socially constructed are things like marriage, private property, and money, for example. On the other hand, philosophers and scientists are concerned with how psychiatric disorders fit into the world. And this actually refers to the kind of classification system that psychiatric disorders should be guided by. So scientists actually make sense of the world by putting things into groups and classes based on scientific theories and evidence from research. Some examples of classification systems include how we classify different types of plants and animals. And philosophers of science have always been interested in the nature of these kinds of things and the rules that guide how they're used. They've also tried to figure out if and how classification systems are related, and more recently, how experimentation in science affect the growth and change of ideas pertaining to classification. So another view that's actually been put forward about these two questions takes a more pragmatic approach. The idea here is that our current understanding and classification system is working to its best potential. And while it's practical now, future research will only provide a better understanding. So we should just work with the current knowledge that we have. And this is actually amounted to the question, do we actually even need to know what the nature of mental illness is for treating it? So I actually now want to get into some controversy surrounding the Diagnostic and Statistical Manual of Mental Disorders. So this is actually the standard classification of mental disorders used by most healthcare professionals to diagnose patients. The DSM adopts a symptom-based approach to diagnosing individuals. So basically what happens is an individual will see a clinician or a psychiatrist, and based on the symptoms that they're exhibiting, that's how a doctor will actually diagnose them. They'll see what symptoms they match with in terms of the DSM. And this has actually been quite controversial because we know that there are different types of psychiatric disorders that have similar symptoms, and they express similar symptoms. So this has actually amounted to a lot of misdiagnoses. And historically, philosophers have been concerned about the legitimacy of the DSM. One of the other issues that gets brought up concerns the various revisions made throughout its history. And the graphic on the right indicates how many DSMs have actually been put out. So for example, I believe in the first ever DSM, or maybe the second, but I believe it's the first, homosexuality was actually considered a mental illness. And this has been one of the motivations behind the view that mental illness is socially constructed, because we know that homosexuality is not a mental illness. And back then, humans chose to distinguish homosexuality as a mental illness, and it was only a mere shift in societal understanding that changed this in the DSM. So this has been one way that people talk about the idea that we've just socially constructed this idea of mental illness. Another issue that philosophers bring up is that the DSM doesn't actually tell us anything about the biological causes of mental illness, which is quite controversial in itself. And so one of my research questions is, can we use evidence from CP research to address these issues? So now I'm going to get into preclinical research on classic psychedelics in depression exclusively. I'm going to start with an introduction of rodent translational research, and then I'm going to talk about rodent models of depression. So this is kind of getting more into what my research is looking at specifically. So rodent translational research refers to when findings from studies on rodents are translated to humans. In the case of classic psychedelics, scientists investigate their effects at the cellular and molecular level. Another facet of rodent translational research is that it's actually informed and guided by data that's obtained from research in humans. So scientists take the data that they've found from humans, and then they apply it to rodents to further investigate. And we know from human depression and research done in humans that there are brain structures and regions that are implicated in depression. So we must, however, consult animals to actually probe the cellular and molecular features of the brain, though. So the aim of rodent translational studies in CP research specifically is to discover the molecular and cellular mechanisms by which classic psychedelics exert their therapeutic effects and the mechanisms underlying the psychedelic experience. And the way that scientists actually do this is by observing the effects of classic psychedelics on rodent behavior, along with investigating what is actually happening within the rodent brain. So you may be wondering, how do scientists investigate behavioral effects in rodents, especially when it comes to depression? Well, they use what's referred to as rodent models of depression. So scientists use these rodents because they've been modeled to reflect symptoms of depression that we see in humans. And there's various ways of getting there. So for example, they might do something what's called a gene knockout, and that's pretty much what they do is they'll find a gene that's been associated with depression, and they'll actually take that gene out of a mouse or a rat, and then that rodent will exhibit depressive symptoms. They may also create lesions in specific brain regions and brain structures that also amount to depressive symptoms. And one way that they test antidepressant drugs is through the forced swim task. So this is actually like one of the most standard ways scientists study depression in rodents and the subsequent effects of drugs like classic psychedelics. So basically what happens here is a depressed rodent is placed in a beaker full of water. And it's believed that due to their depressive symptoms, they lack the motivation or care to swim. However, when a depressed rodent is given a classic psychedelic, they actually start swimming. And this is supposed to be a measure of the antidepressant effects of classic psychedelics. So this is just one method that is used in translational rodent research. There's other behavioral tests and paradigms that scientists use to model depression in rodents. They could try to measure like a specific type of symptom, or they might use a specific type of test to test the specificity of an actual antidepressant drug. But the forced swim task happens to be the most popular one that's used. So I'm going to actually now move on to clinical research on classic psychedelics in depression. So I'm going to go over the recent advances, and this will be a quite brief overview. If you have any questions about what's actually going on in this research, you can ask me during the Q&A section, and I'll be happy to answer to my best potential. I'm also going to move on to the default mode network, and I'll get into a little bit of that. It's a network within the brain. And I'll end this section with a discussion of the potential implications that evidence from this kind of research has on psychiatry and the issues that I brought up earlier. So research on classic psychedelics in depression exclusively is fairly new, having only been conducted in the last decade alone by 3 research groups. So I think that in particular, this emerging area of classic psychedelic research serves as a good case study for understanding and thinking about the implications that evidence from psychedelic research can have on philosophical issues in psychiatry. What they found in this research is that classic psychedelics have rapid and long-term antidepressant effects. More specifically, they found that it improved depressive symptoms for up to a year. And neural imaging techniques that have been used in these studies have actually indicated that there's a subset of brain regions that CPs impact, and these regions are actually also implicated in depression. And they also happen to be regions that are rich in the 5-HT2A receptor. And lastly, these areas are actually part of the default mode network in the brain. So these research studies have placed significant emphasis on findings pertaining to this brain network. And there's strong evidence that the default mode network mediates psychedelic and therapeutic effects of CPs. And I'll get a little bit more into details about this in the next few slides and the importance of the default mode network in CP research. So the default mode network refers to a set of interacting brain regions that have been shown to be important in self-reflection and introspection. So that is how we perceive ourselves in the world and our relationship with others. And previous research on depression has actually shown that excessive DMN or default mode network activity is linked with depression. And research on classic psychedelics in depression has actually shown that they decrease activity within the default mode network. So what this means is that they decrease activity between these interacting brain regions. What's actually also been shown is that classic psychedelics also increase activity between the default mode network and other brain networks and other brain regions. For example, actually what they've seen is that there's increased activity between the default mode network and the amygdala. And the amygdala actually is a part of the limbic system and the salience network. And this is important for regulating emotions and memory. And what I really want to get at with this data is that it's believed to show that classic psychedelics allow large-scale brain networks and the individual brain regions within them to interact more fluidly and flexibly. I guess you could consider it to be that classic psychedelics can like unstuck the brain. I hope that makes sense. And what I take to be most interesting from this finding is that these brain networks have been found to be implicated in very specific human behaviors. And when malfunctioning, they are associated with symptoms and cognitive deficits associated with depression. And cognitive deficits refer to maladaptive functioning and learning in memory, and that has been associated with people who have depression. And so I think it's really important that while research has been done on these brain networks and brain regions independently, psychedelics, especially classic psychedelics, have been shown to have an impact on all these brain regions and these networks. And I think this is very unique because we haven't observed this with typical psychiatric medications that are commercially available and in drug development in general. So based on these findings, the running hypothesis, which I will refer to as the default mode network hypothesis for the sake of this presentation, is that if classic psychedelics have been shown to decrease activity within the default mode network, while also at the same time increasing activity between the default mode network and other brain networks and regions within them, then they may disrupt excessive and repetitive patterns of maladaptive thoughts and pathological emotions. And this theory is very specific to a common depressive symptom called rumination. It's believed that CPs can ameliorate this depressive symptoms by action on the default mode network. So I'm now going to talk about some potential implications that this evidence has in psychiatry and also some of the philosophical issues that I talked about. So I think that psychedelic evidence can contribute to the philosophical debates pertaining to explanation and classification. And I'll get into that more in the next few slides. But actually, I think that this is going to have a lot of impact on social, legal, and medical reasons. For example, in terms of social reasons, it may alleviate the stigma of mental illness, because if we're able to actually show that mental illness is a brain disorder, just like, say, Parkinson's disease or Alzheimer's, then people will have a better understanding and they won't associate mental illness with some sort of negative aspect. And I hope that it will reduce the stigma or at least get rid of it. And I think in terms of legality, I'm not really sure how much this would play into Canada, but I know in America there are lots of issues in terms of insurance companies and how they actually set up and construct their policies and what they consider to be psychiatric disorders. There are some instances where individuals with a type of psychiatric illness don't actually get their medication covered because their insurance company doesn't consider it to be an actual disorder of the brain. And I think, again, this is important for medicine as well, because currently we don't have any drugs that can affect the brain like we have seen in terms of classic psychedelics. And one of the most interesting things that I found with classic psychedelics and what really was appealing to me is that classic psychedelic research is quite different from the canonical drug development that is traditionally going on. So what happens in terms of drug development is that the drug is created in a laboratory setting, and then it's tested on mice, and then it's tested for its safety and effectiveness, and then it's only then that it can be used in clinical trials. But what's most interesting about classic psychedelics is we actually first saw the effects of them on humans. So, most of these drugs are actually naturally occurring substances in the world, and we know through history the effects that they've had on people. And now we're actually able to take these findings and then apply them to rodents, and then actually then try to gain a better understanding of what's going on mechanistically. So it's, in a way, it's kind of like a reverse translation. We started with humans and now we're going to rodents. I found that very interesting because that's not what you typically see in drug development. So I think based on the data that's been obtained from these studies, it's very clear that brain mechanisms are at play. And this is an indication that mental illness is a naturally occurring phenomenon. So we know from this research that the 5-HT2A receptor is important to understand in how classic psychedelics work. But this research has also given us a better understanding of brain structures and the way that different brain regions and networks interact. So again, this is very telling that mental disorder is a brain disorder. But to further validate this, we need to get a better understanding or a better idea about what's going on at the molecular and cellular level. What's very interesting, actually, is that the binding power of classic psychedelics was first discovered by genetically engineering the human 5-HT2A receptor into a rat's brain. So scientists were able to validate the relationship between CPs and the 5-HT2 receptor through this kind of experimental intervention. And I think with further neuroimaging studies, we can actually become more aware of what brain structures and brain regions and networks to probe. And this would actually amount to the discovery of brain mechanisms within these brain regions. And this may actually tell us what's actually underlying depression. So studies on different psychiatric disorders may shed light on other areas of the brain that are associated with, for example, PTSD and anxiety. Sorry about this. I didn't realize I didn't this, but yeah, like I said, we need to understand how CPs work in the brain, and we need to know what happens, what are the downstream effects that occur after the classic psychedelics actually bind to the 5-HT2 receptor. So ideally, what we want to do with this data obtained from this research is we want to shift from symptom-based diagnoses to diagnoses that actually are based on biological causes. And it's important that further inquiry and testing of some of the hypotheses that have been put forward about classic psychedelics can lead to the discovery of the kind of brain mechanisms scientists are aiming to discover through rodent translational research. And of course, there is the fact that all of this can lead to a potentially novel mode of therapy. And so now I'm going to move on to challenges in CP research. And what I really want to do here is kind of highlight the knowledge gaps between preclinical and clinical research. So like I said, this is a very promising area of research. It can change psychiatry potentially, but there are some challenges and issues that we need to address in order to advance progress in drug development. So scientists interested in investigating the therapeutic effects of classic psychedelics are looking for a distinct kind of knowledge. They're seeking to find mechanisms, not only of the antidepressant effects of psychedelics, but also the mechanisms underlying the psychedelic experience. However, what I aim to show within the next few slides is that there's issues with study design and challenges with methodologies in human depression. And that's why we must consult animal models to probe the molecular and cellular level. But there's also challenges within rodent translational research as well. So I'm going to get into this now. But overall, what I want to show is that there's disconnect between preclinical and clinical research. So when it comes to concerns with human studies, the most important one is that these are small scale studies that actually don't rationally generalize to the clinical population. For example, all depressed humans in the world or everybody with PTSD. So what we need are like larger scale studies to actually be able to take these findings and then so that it can actually rationally apply to the overall population. And the great thing about neuroimaging is that it has provided us substantial information about brain regions that are implicated with the effects of psychedelics and depression, but doesn't actually inform us about brain mechanisms. And that's, again, why we need to consult rodents, for example. But there's also conflicting findings across studies and different research groups. So one of the things that I want to discuss in terms of conflicting findings is that when you look at the publications and the data within it from the research groups that are looking at classic psychedelics and depression, they actually have conflicting findings about what the therapeutic value of the psychedelic experience really is. So it's not clear. So for example, one study has indicated that the mystical effects are more pertinent to clinical outcome than, say, the hallucinogenic effects. But that's quite interesting because ayahuasca, for example, which is used traditionally in Amazonian religions, the auditory and visual illusions actually play a quite prominent role in the healing aspect of ayahuasca. So I thought it was very interesting that some research indicates that the hallucinogenic effects don't quite matter. But other research groups have actually indicated that the psychedelic effects don't matter at all, that they have had no effect on the long-term antidepressant effects of psychedelics. So this has actually resulted in a debate. Does it really matter to have the psychedelic experience? Is it necessary for treating psychiatric disorders at all? And this is why, again, we need to test on rodents, because we need to know what's going on at the molecular and cellular level in terms of the psychedelic experience. So moving on to concerns with rodent models of depression. So yes, rodents are very similar to humans in terms of brain structures. They have been very valuable historically in terms of drug development and investigating different types of diseases. But there's a lot of controversy around the forced swim task and other tests that have been used. So questions about whether these behavioral tests actually measure depression in rodents. And there's also the question of whether rodents even get depressed. And what I'm going to talk about in the next slide is something that I'm actually the most interested about. And this is the question of, can we even study the psychedelic experience in mice? So the psychedelic experience is difficult to evaluate in mice. In fact, it's an open question whether mice even have these kinds of experiences at all. That is a kind of experience that we want to call psychedelic. As far as we know, rodents don't use concepts like liberated and connectedness. So why would we think that a rodent's experience is anything like a human's? Yet, if we can't determine that mice have such experiences, how can we use them to understand the neural mechanisms that underlie the human psychedelic experience, or why psychedelics work to treat some mental illnesses, for example? I do think that using rodents for this purpose requires that we understand something about their experiences. But again, the question is, how do we even go about finding this? Like, how do we go about figuring out this? How do we investigate it? How do we actually observe it and measure it? So moving on to the conclusion of my presentation, I'm going to now discuss the importance of philosophy of science in psychedelic psychiatry. So it's clear that classic psychedelics can potentially transform psychiatry. I've only given a brief overview of distinct issues in clinical and preclinical research. There's other issues that need to be addressed. For example, one thing that my supervisor and I noticed was that in rodent studies, Scientists have only investigated the effects of classic psychedelics on mood. They haven't actually investigated cognitive deficits in rodents and how classic psychedelics affect that. So, for example, how does it affect the learning and memory of rodents? And so what they can do is they can actually create deficits in learning and memory and then test the effects of psychedelics. But I haven't seen research studies do this, but there are ways to do this. And there's also the issue with the default mode network. So I haven't actually seen any studies investigate the default mode network in the brain. It's a question of whether they actually even have this. So this is one thing that needs to be addressed as well. But I think philosophy of science literature can offer tools for addressing these issues. I think philosophers of science can bridge the knowledge gaps between humans and rodents. So there's two aspects of philosophy of science that I want to bring forward today. One is a method called philosophy of science in practice, and the other is a discussion about some conceptual or theoretical tools that have been introduced in the philosophy of science literature. And I think that these tools can be used to address some of the issues I mentioned with respect to preclinical and clinical research. And some philosophers, such as my supervisor, Dr. Jacqueline Sullivan, have already addressed similar issues in neuroscientific experimentation using these methods and tools. So we can borrow from the literature and apply them to the issues in psychedelic science and psychiatry. So with respect to philosophy of science in practice, it's an emerging method in philosophy of science. And this method entails that philosophers of science actively participate in the day-to-day activities in a laboratory setting and critically evaluate the processes involved in scientific experimentation, such as experimental design, tool development, and the analysis and interpretation of data. And this is proving to be a very notable method to conducting philosophical research in science because it actually involves embedding oneself in the life of a lab. And this is in comparison to traditional philosophical methods, such as armchair theorizing, which refers to philosophers only analyzing the findings scientists publish in journals. And the last thing I want to discuss are the conceptual tools and philosophy of science. So in the literature, philosophers of science have discussed knowledge benchmarks that scientists should aim for, and I'll discuss this quite briefly. I don't want to get into the technical terms and jargon, but I can discuss more of this in the Q&A section. But these concepts and these theories that have been put forward in the literature, they can be used as conceptual tools to assess the validity of experimental processes and the reliability of data. So there's two concepts that I'm going to mention. The first is called external validity. And essentially what this is referring to is the question of like, how well does your experiment generalize to the real world? So you can think about it in terms of the investigations that we do in rodents. Well, okay, how are we actually investigating the psychedelic experience in rodents? Like, is it actually telling us about the psychedelic experience that we see in humans outside of the laboratory? So external validity is something that philosophers of science say that scientists should actually aim for. We want to make sure that what's going on in the laboratory setting can actually be applied to the real world. The other thing that I want to bring up is a concept called construct validity. And this is a measure of how well the tools that you're using are actually measuring what you intend to measure or what they're designed to measure. So how well do the tools employed? So for example, the behavioral tests like the forced swim test measure what they're designed to measure. And in this case, it would be depression. So philosophers of science emphasize the need for scientists to meet benchmarks like this and other benchmarks as well in order to obtain reliable data. So this is where I'll end my presentation. Thank you very much, everyone, for listening to me today. Thank you, everyone, for attending today. I really appreciate it. It's really great. I'm really grateful that as a PhD student, I can present my work. It's not very often that students get the opportunity to do this at such a large scale. So thank you, everyone.
Thank you so much for joining us today, for presenting this fantastic talk. It's been a pleasure. Thank you everybody who attended live and everybody on the recording seeing this after the fact. Yes, that should do it to wrap up this sixth in our mind philosophy series. Once again, thank you very much, Jaipreet. It was fantastic.